Hi, my name is Jenna Thomason. I'm a PGY1 pharmacy resident at Oklahoma State University Medical Center. The research project I will be presenting on at OSU Research Day this year is the assessment of empiric outpatient therapy and readmission rates from the emergency department for community-acquired pneumonia. During this presentation, we will go over the background of my research project, look at the study objectives, the endpoints, then go through the methods and discuss preliminary results, and finally the conclusions of the project so far. Community-acquired pneumonia is a very common reason both for emergency room visits and for readmission rates. The Center for Medicare and Medicaid Services has a program called the Hospital Readmissions Reduction Program that they developed in 2012, and one of their targets is actually to decrease readmission rates specifically for pneumonia. One study looked at the causes for readmissions secondary to pneumonia and also looked at if those causes were avoidable or unavoidable. Of all of the avoidable causes of readmission for community-acquired pneumonia in this study, the highest percentage of these avoidable causes, 31.7%, was either related to a missing or incorrect diagnosis or related to incorrect therapy. Emergency department physicians are in a unique position to impact both of these factors, given that they are often the ones doing the initial diagnosis and starting the initial empiric therapy. The first aim of my project is to look at the current prescribing habits at OSU Medical Center for empiric antibiotic regimens prescribed from the emergency department for the outpatient treatment of community-acquired pneumonia. We will evaluate the appropriateness according to the most current pneumonia guidelines, the 2019 Community-Acquired Pneumonia Guidelines. The second aim is to look at the current readmission rates for our patients that are treated outpatient for CAP from the emergency department. And after assessing both of these, we hope to find some areas for quality improvement and develop targeted interventions to improve our prescribing habits and increase adherence to the current community-acquired pneumonia guidelines. The primary endpoint for this study is the adherence to the current 2019 community-acquired pneumonia guideline recommendations for the outpatient empiric therapy of community-acquired pneumonia. Secondary or exploratory endpoints are readmission within 30 days of the emergency visit initially for any cause, and then also readmission within 30 days specifically for a worsening pneumonia. This project was conducted as a single-center retrospective observational chart review. Every patient chart in the study was independently reviewed by two different investigators, and a third investigator was available for a tiebreaker or a final statistical decision if necessary. Descriptive statistics will be used for our data analysis. For a patient to be included in the study, the patient had to be 18 years or older, they had to have an ICD-10 diagnosis code for pneumonia, and they also had to be discharged from the emergency department between July 1st, 2021 and June 30th, 2022, so one full residency year. Exclusion criteria included any patient that was less than 18 years of age, any patient that had a risk factor for multi-drug resistant organisms as according to the community-acquired pneumonia guidelines, and then any patient that was admitted to the hospital from the emergency department. Data collection and analysis for this project is still ongoing. To date, we have completely finished 28 of the charts. 157 total charts returned from our report that we ran. Out of these, 114 patient charts were included and then 42 were excluded. So 4 were excluded because they had a prior respiratory isolation, a sputum culture that had grown either MRSA or Pseudomonas in the past. 13 of these patient charts were excluded because they had a recent hospitalization and had also received IV antibiotics within the previous 90 days as compared to their encounter that we were looking at. And then 25 of these patients were excluded because they were under 18 years of age. Of the 28 charts that we have completely finished reviewing to date, 7.1% did receive appropriate therapy as compared to the 2019 guidelines, and 92.9% received inappropriate, incorrect therapy. Most common reasons for incorrect therapy are listed below. So extended duration and incorrect or incomplete drug regimen were the most common. A combination of both extended duration and incorrect or incomplete drug regimen was also a very common reason. And then there was one that was incorrect because of our current local antimicrobial resistance patterns. 4 secondary outcomes, which looked at hospital readmission within 30 days for any cause and hospital readmission specifically for worsening pneumonia. There were 10 total readmissions out of the 28 charts that have been completely reviewed for any cause, and of these 10 readmissions, only one of those patients had received correct empiric therapy. There were 3 total readmissions out of those 28 charts that have been completely reviewed that were secondary to a worsening pneumonia, and of those 3 patients, none of them had received correct empiric therapy. As I mentioned on the previous slide, data collection and analysis for this study is still ongoing. Just based on the preliminary data, there are a few conclusions that can be drawn. So only 2 of the 28 patients that we've completely finished reviewing received guideline recommended therapy. Of these patients, there were 10 total readmissions for any cause, and there were 3 readmissions for worsening pneumonia. So after this preliminary review, it is possible that there are some educational interventions on recommended outpatient regimens we can do with our ER group that may improve ED physicians' adherence to the CAP 2019 guidelines. Listed here again is my contact information, and I am more than happy to answer any questions that you may have about my project. Thank you.